I just felt so bad about the way this presentation was going to end that I tried to think of some things that might work in our favor in the next few years, even if they're not, lasting. So federal economic recovery bill. A lot of economists, particularly on the left, are saying things are worse than the Obama administration ever anticipated. Everybody thought that the package they passed in February was too small. Now we know it was too small. Are they going to? There's some talk of trying to come back and do another one. Most people aren't very hopeful, but you never know. If there's more money, that's going to be more money to help California. If we get federal health care reform or health insurance reform or whatever we're calling it, what will that mean for California? There have been news reports about concern about making more people eligible for Medicaid, because is the federal government really going to pay indefinitely for all of those new folks, or eventually are they going to squeeze the states and say, all right, back to your regular FMAP, California, you're paying half the cost of all the new people we just made eligible for Medicaid. That could have a negative impact on the budget, but there may be a lot of stuff in a package of reforms that would be positive for the state over the longer term. Some of you also may have heard about some groups so disgusted with where we're at now that there's one group out there funded by big foundations that's been going around the state asking Californians, what do you think is wrong with the state and what should we try to do about it? They're called California Forward. They're going to put together a package of revisions and ask the legislature to adopt them and put them before the voters in 2010, affecting the state-local relationship. I don't know about revenues, but anyway, they're concerned about this and they're going around trying to figure out what to do. There's another group that's talking about the possibility of trying to get the California voters to amend the Constitution. Right now, we, the voters, cannot call a constitutional convention. Only the legislature can. So the idea here is you have a two-step process. You go to the voters and you say, do you want to amend the Constitution to allow the voters to call a convention? And then step two, do you want to call a convention? If both of those things pass, there could be convened a constitutional convention. That some people are saying, well, we better not leave it open to everything. We better keep some things off the table. There's a question about whether you can really limit. If you get 400 people in the room, is it going to be like Philadelphia in 1787, where they basically threw out the Articles of Confederation and said, let's do our own new document? That really could happen, but anything that would be done would have to come back to the voters. So there are a lot of people in what you might call the political elite of California who are very unhappy with the current situation, and it's not really clear how we get out of this. Everybody knows we're broken. The system is broken right now. It doesn't work, but there's no clear path on how we get out of where we're at now. So anyway, I'm not sure to what extent that was really a way to end on a positive note. I tried my best, and thank you for your time. I do have time for a few questions if anyone has them.
It's an inflow and outflow. I think again, you stay low. That's right.
I don't think. Yeah. Can you just sum up what he said, Rick, and then?
I think Carl was saying that our two-plan model was very effective in recruiting and enrolling people who were eligible. But I think what happened in the recession is that a lot more people around the state lost jobs and lost income becoming eligible, but less so in LA County, where we have pretty large and documented population, and who were the most vulnerable in the economic recession, in construction and other kinds of sectors where they were the first people laid off and contributing to the growth in the unemployment rate, but not eligible for growth. That makes sense. Yes.
That makes sense.
I think our enrollment dollars also went down, but I don't know if that was consistent across the state.
But I do want to thank you for such a sugar-coated presentation.
I'm not ready to stop your team for
very impressive.
Anybody else want to fire one at me? I came all the way down from Sacramento to bring you good tidings. And okay.
We're in shock.
I aim to shock and awe at the same time.
Could we secede? Could we make two states out of California? Out of Southern California?
I think there's going to be another effort actually you may see initiatives, petitions circulating to undo the 2/3 vote requirement on budget and taxes. I don't think those are out yet. I think it's queued up at the Secretary of State's office. I'm not sure who's behind it, but remember, they would bring it down to 55%. It's not 50 plus 1, it's 55. Why? Democrats tend to have about a little over 55%. So that would sort of give them the sway that they may want. But remember, we tried, not we, but the voters, this was posed to the voters in 2004 as Prop 56, I think. It went down big time, like 2 to 1. So, and the election, the thing wasn't even about, it started to become, they put this thing in there about we're not going to pay legislators when they don't do the budget on time. That was sort of in there as a way to make people think, voters think that's what this is about. Let's get back at those legislators who can't get their job done. But it still went down 2 to 1. So it's unclear what's going to happen this time. If things have gotten so bad that people are willing to say, you know what, let's give this a try, we can always undo it in the future.
Thank you.
Anybody wants to volunteer to give Scott a ride to Burbank? Probably appreciate it. Otherwise, he's on his way. Thank you so much. Next, our presenter is Dr. Susie Baldwin, who is a preventive medicine public health physician whose career is focused on women's health and reproductive health, especially in underserved populations. Dr. Baldwin serves as Chief of Health Assessment in Los Angeles County Department of Public Health, where she oversees the LA County Health Survey. She volunteers as a physician for survivors of human trafficking at the Sabin Creek Clinic, and occasionally provides clinical services at Planned Parenthood in Los Angeles. She is a medical director for the California Family Health Council, which oversees federally funded family planning services. She is a board member of the National Organization of Physicians for Reproductive Health, an active member of the new LA chapter of Physicians for National Health Program, California Physicians Alliance. Dr. Baldwin is going to give a brief presentation of the study that was done on health indicators for the service planning areas of Los Angeles County. I think you all have a copy of this, and it's a culmination of work that's gone on for years in the Department of Public Health. The information is becoming more and more comprehensive, meaningful, and very important to the work that we're doing. So I want to welcome Dr. Susie Baldwin here to present this to us. Thanks.
Thank you, Ron. Before I get started on the key indicators of health presentation, I wanted to make one comment regarding the earlier discussion with Drs. Brown and Zelman. How many of you attended the South LA Conference on Health and Human Rights last month? Not too many. Well, it was a very exciting and impressive event, and speaking as an individual and a member of Physicians for National Health Program, I just want to put out there that there is a perspective that's not being heard generally when we discuss healthcare reform or health insurance reform, and it's the concept of health as a human right. And we're dealing with a system in our country in which health is a commodity and not a human right. And the debate is very much structured around that concept and leading us to a system that is fundamentally inequitable and immoral. What I see in the county clinic, and not the county clinics and community clinics, is downright immoral what patients have to go through to get care or not get care. So I just want to put that out there. Now, on behalf of Los Angeles County Department of Public Health, I present to you a summary of the key indicators of health. And the books are outside and stacked. If you don't have them, we did bring extras for you to share with your organization.